Hello, and welcome. Today, we're diving deep into a specific and often challenging form of heart disease, Lamin cardiomyopathy. This is a genetic condition affecting the heart muscle, and understanding it is crucial for both patients and healthcare professionals. Lamin cardiomyopathy stems from mutations in the Lamin gene. This gene provides the instructions for making Lamin A and Lamin C proteins. These proteins are vital components of the nuclear lamina, a structural scaffold inside the nucleus of our cells. Mutations disrupt the proper function of this scaffold, ultimately leading to heart muscle dysfunction. The pathophysiology of Lamin cardiomyopathy is complex. The mutated Lamin AC proteins disrupt the structure and function of the nuclear lamina. This impacts the cell's ability to maintain its shape, organize its DNA, and respond to external signals. In heart muscle cells, this leads to abnormal electrical activity, weakened contraction, and ultimately, structural changes characteristic of cardiomyopathy, like enlargement and thickening of the heart muscle. Fibrosis, or scarring of the heart tissue, also contributes significantly to the disease's progression. Lamin cardiomyopathy is a relatively rare condition, but its exact prevalence is difficult to determine due to underdiagnosis. It's estimated to affect around 0.2% of all cases of dilated cardiomyopathy. The condition affects both men and women, but men tend to experience more severe symptoms in earlier onset. It can manifest at any age, from childhood to adulthood, with the most common onset being in the third or fourth decade of life. The signs and symptoms of Lamin cardiomyopathy can be varied and may not appear until the disease has progressed. Common symptoms include palpitations, shortness of breath, especially during exertion or when lying down, fatigue, lightheadedness or fainting, swelling in the ankles, feet, or abdomen and chest pain. Importantly, individuals with Lamin cardiomyopathy are also at high risk of developing arrhythmias, or irregular heartbeats, and sudden cardiac death. Diagnosing Lamin cardiomyopathy typically involves a combination of methods. A thorough medical history and physical examination are the first steps. An electrocardiogram, or ECG, can detect abnormal heart rhythms. An echocardiogram uses sound waves to create an image of the heart, allowing doctors to assess its size, shape, and function. Cardiac MRI provides a more detailed view of the heart muscle and can help identify areas of scarring. Genetic testing is crucial to confirm the diagnosis by identifying mutations in the Lamin gene. In some cases, a cardiac biopsy may be performed to examine heart tissue under a microscope. While Lamin cardiomyopathy is primarily associated with dilated cardiomyopathy, meaning the heart chambers enlarge, it can also manifest as other types. These include hypertrophic cardiomyopathy, where the heart muscle thickens, and restrictive cardiomyopathy, where the heart muscle becomes stiff. Additionally, some individuals with MNNA mutations may primarily experience conduction system disease, characterized by problems with the heart's electrical pathways, without significant changes in the heart muscle size or shape. The treatment for Lamin cardiomyopathy focuses on managing symptoms, preventing complications, and slowing the progression of the disease. Medications like ACE inhibitors, beta blockers, and diuretics can help improve heart function and reduce symptoms like shortness of breath and swelling. Antiarrhythmic medications or an implantable cardioverter defibrillator, or ICD, may be necessary to prevent life-threatening arrhythmias and sudden cardiac death. In advanced cases, a heart transplant may be considered. Regular monitoring by a cardiologist is essential to adjust treatment as needed. Currently, there is no proven way to prevent Lamin cardiomyopathy, as it is a genetic condition. However, genetic counseling and testing are available for individuals with a family history of the disease. This can help families understand their risk and make informed decisions about family planning. Early diagnosis and management can also help to slow the progression of the disease and improve outcomes. The prognosis for individuals with Lamin cardiomyopathy can vary significantly. Some people may experience a slow progression of the disease, while others may develop severe heart failure and life-threatening arrhythmias. Factors that can influence prognosis include the specific MMA mutation, age of onset, and the presence of other medical conditions. Recent research is focused on developing targeted therapies that address the underlying genetic defect. Gene editing approaches, which aim to correct the mutated Lamin gene, are being explored as a potential future treatment. Studies are also investigating the use of novel medications that can reduce fibrosis and improve heart muscle function. Continued research offers hope for improved outcomes for individuals living with Lamin cardiomyopathy.